Morning, everyone. Very happy to be here representing ATREON and presenting you our system for remote monitoring of inflammatory arthritis, the ATREON. So basically, we have developed a system to remote monitor arthritis in patients with an app for the patient. They can take pictures from their hands at home, provide data, and a healthcare professional dashboard to do remote consultation, optimize the scheduling of patients, optimize the capacity of the centers they're working in. But earlier today we heard that we can predict many things with data, but we cannot do many things and act on the patients. Where with arthritis it's a bit different. Today the only way we can track the data in patients are usually subjective scores, and we don't have any metrics or accurate data to know what happens with the patients in between the visits. But we have efficient ways to treat them when we can predict what happens later, or what happens in terms of disease flares that could happen when the patients are at home. So we developed technologies to remotely measure what happens in terms of, sorry, the pointer doesn't seem to, oh well. So we developed technologies to objectively measure the impact of inflammation, of arthritis in patients, such as the finger fold index, which we have patented. Basically, the patient takes a picture of the hand and it tracks the dorsal finger fold patterns as well as the diameter of the joints, and we see metrically over time the inflammation in these patients. We are also developing technologies like Mephisto, where, as you can see, the patient film himself doing this motion. It tracks the range of motion in the fingers, in the joints, and we can metrically assess how the inflammation is affecting the stiffness and the motility of the joints. So we can track that very easily from home. And the patient can do that very easily with the app, roughly 20 seconds, 30 seconds for an input. And what we want is to change the patient journey from, if you are lucky enough to have a rheumatologist that follows you, we're going to have like every 4 to 6 months an appointment. We don't really know what happens in between, and if something is wrong, you can not really book a quick visit because very few flexibility to book such a visit, to a patient journey where if you're stable, you can stay at home, you monitor yourself with the app, everything is taken care of. We can contact you if something is wrong. We can earlier, with more flexibility, book a visit and improve your outcomes. So the market in inflammatory arthritis is huge. The drugs are very expensive. The diagnostic market is also very expensive. And unlocking remote monitoring in this field will really free up that market even more. We have a business model that includes the development and the research phase where we validate the biomarkers. We also develop a prototype, compliant prototype to implement, and now we're switching to more of a pilot implementation phase where we test the prototype within different centers. So we test the product, we collect data on how to implement it, how best to use it in remote monitoring practices. And later on, with all the data that we collect, we're developing models for prediction of flare and disease activity, which could later be used in clinical practice. In terms of financial projections, well, you can come at the booth and we can discuss a bit more about that, but these are calculations have been made with Switzerland as a test market, and then Germany and the US as target markets, where already existing policies for reimbursement of such solution are implemented. We're just coming back to the United States, where we got really promising feedbacks about the fact that they're already using these type of solutions, but they lack metrical, objective measurements in these patients, where they only do patient-reported outcomes for now. So the idea started 4 years ago, and from that we managed to do a proof of concept study, got support for a patent, then we got support to develop a prototype, move to clinical studies. We got an InnoSuisse funding also to develop more the business side, and recently we secured the European funding for external implementation in other centers in Europe of the system, test implementation. And yeah, with that, I would like to invite you to come at the booth if you have any questions or if we can exchange about that, and would like to thank our great team, which I'm very proud of. And yeah, thank you very much.